Aloha and welcome to the Genie Show. My name is Jeannie Joseph and I have a very special guest with me tonight. I have Dr. Melissa Green, and she's a licensed clinical psychologist who works on one of the military bases here in Hawaii. And we're going to be talking about a subject that I think is very important, and I think a lot of you do too, and that's the issue of PTSD, post-traumatic stress disorder. Aloha, Dr. Green, thank you for being here.
Aloha, thanks for inviting me.
Oh, great, good to have you. Now, let's start with defining what is PTSD, post-traumatic stress disorder.
PTSD is actually an anxiety disorder that can result from experiencing a traumatic event or witnessing a traumatic event, such as something that might occur during combat or child sexual abuse or some other type of sexual assault, or things such as car accidents or natural disasters.
Okay, so it's important to understand that PTSD is not just a military problem.
Right.
That anybody could experience PTSD if they were in a set of circumstances that was traumatic enough or prolonged enough. So it's not just a military problem, it's a people problem, and certainly a lot of people are either have family members who are in the military or know someone, and so they may need, it's really helpful for people to understand what it is, to be able to recognize it and perhaps be able to suggest to someone that they go and get help. So if you were someone who was experiencing PTSD, what are some of the things that you might be experiencing?
Well, some of the natural reactions to trauma are things like avoiding some of the things that might trigger thoughts about it, maybe increased irritability or having outbursts of anger, feeling detached or numb from people, isolating yourself, maybe depression, other types of symptoms of anxiety as well.
Okay. So for example, somebody who had a traumatic experience, they might find that when they're back in their daily life that something occurs, we call them triggers, that puts them back into that experience, and all of a sudden it's like their mind is back where they were, the source of that trauma. And that can be very challenging for people because often they don't know what those triggers are, you know?
Right,
Yeah.
right. And again, some of these things are just typical responses to a traumatic experience, and they generally go away naturally. However, if these things persist or they become more intense, after a period of about a month or so, then you should consider actually being evaluated by a mental health professional.
Mm-hmm. Now, is it easier? I know for a lot of military people in the past, it used to be there was a kind of reluctance to admit they had a problem because they're used to being tough and they're used to being able to handle it, and they might have thought that perhaps if they went and got medical help that they might be perceived as not being, you know, functional or letting their buddies down. Is that changing? Are you seeing that the culture of that is changing?
That's definitely changing. I think in just the general population, there is a negative stigma with seeking out mental health services, and in the military population, there may be even more of a stigma associated with that in the past, and we are seeing a lot of changes, and people are becoming a lot more open to receiving and seeking out mental health support.
Okay, great. And so let's say another one of the symptoms we talked about, I think avoidance, we talked about hypervigilance. Let's kind of walk through that. What would a hypervigilant, if someone's having hypervigilance, what would that look like?
If someone is having symptoms such as hypervigilance or being overly alert or constantly analyzing the environment, they may be scanning the environment for things that may be perceived as dangerous. So when you go out to maybe a crowded restaurant, or you go out to just a store, and you notice maybe the positioning of a person, or you notice the things that they're wearing, or you start to notice a lot of detail or things that maybe you didn't pay attention to before, that sort of falls into that realm of being hypervigilant.
Okay.
So that's one of the clusters of symptoms of PTSD. Also, you mentioned the avoidance. People oftentimes will avoid places or people or activities that may trigger certain thoughts or emotions that are related to the traumatic event. So they may have a tendency to become withdrawn.
And I know I've heard some military people talk about they come home and there's some trash on the road, and in the past that would have been just trash on the road, and of course situations that they might have experienced with that could have been a life and death situation, and so it becomes difficult to adjust to, I don't know what you want to call it, civilian life, normal life, and to not have the intensity of reactions that they had.
Right. What happens when we experience a traumatic event is that we start to make these associations between things in the environment and that actual event. So things that may have been a neutral stimulus for someone before becomes tied to that traumatic event. So perhaps, like you were saying, seeing trash on the side of the road, that could become a cue for danger in the environment that the person was in before, maybe a combat-related environment. And then they generalize that experience to other situations where the likelihood is pretty low that there's danger there.
And this is part of, retraining the brain how to, of course we need that vigilance in combat situations, and then we come, home, we're redeployed, we're back home, need to be able to teach that brain, okay, new, kind of like reset, new world, if your wife moves your keys, it's not the end of the world, and you have to kind of put on a different whole mind,
right, right.
to adapt.
Those skills like the hypervigilance and being alert, those kinds of things are actually necessary for survival, and it's our body's natural way of responding to danger or perceived danger. So in a combat situation, that's something that could help to save a person's life. However, as you mentioned, we do have to retrain the brain and the body to respond differently when you're removed from that environment.
Right, okay. So what are some of the top therapeutic methods that you've been finding have been helpful with PTSD?
The primary treatments that are empirically supported are mostly cognitive therapies. There's prolonged exposure therapy, which is a type of therapy that essentially helps the person to gradually increase their exposure to those things that are creating a lot of discomfort, a lot of anxiety. Also, it helps them to increase their exposure to some of the traumatic thoughts or memories that maybe are coming up unexpectedly. So we do that in a safe environment and help them to process this event and put the story back together again in a more reality-based way. Because oftentimes our thoughts become distorted when we experience traumatic events. Also, another type of treatment is cognitive processing therapy. In cognitive processing therapy, a lot of emphasis is placed on helping to change some of those thoughts. Maybe there was a lot of responsibility that the person had taken on inappropriately, a lot of feelings of guilt, a lot of distorted thinkings about how maybe they should have done something differently or could have done something differently to make the situation turn out in a better way.
Right. I think we all have moments where we think, oh, I could have done this better, I could have done that better, but when that's tied to a life and death situation, maybe, a buddy didn't make it or something like that, and you wonder, did I do my best? Could I have done something different? If there anything different I could have done in that kind of continual replaying, I mean, it's very hard on an individual who's plagued with that kind of thinking, and to help someone be able to stop that kind of thinking is very important.
Right. Experiencing a traumatic event often causes a person to change the way they perceive themselves, the world, and the interaction between themselves and other people. And so we help them to understand how that incident has impacted their worldview.
And EMDR is another method that you also work with. Tell us about that, how it works.
EMDR is eye movement desensitization and reprocessing. And I don't personally use this, but this is another form of treatment that has a lot of research backing and has been shown to be effective, where the therapist will use eye movements to help the person to retell their story in a different type of fashion. So it's introducing something different.
Yeah, I think that's a very important modality, because I think one of the things we notice is that it's not memory, it's not the experience necessarily that causes trauma, but it's how it gets stored in the brain. And if we can teach the brain to store it in different ways, we can begin to bring some relief. And so I'm definitely excited about that modality. Great. So I know that I know you don't work with spouses, you work with active duty, but a lot of spouses have said, I don't recognize this person. Who's this person who's come home in my husband's body? And are they often the person that says to their husband, go get therapy, or is it often the service member themselves that says, hey, I'm experiencing this, I need to get help?
I think oftentimes people get feedback from the people around them that maybe things are different, maybe they're doing something that they didn't do before, or they're not doing something that they used to do, and that can be a push or a motivating factor for treatment. But also there are a lot of people who are recognizing that there are differences on their own.
Yeah. Well, that's really important, and I think it's so important that we change the culture, which means, all the way from the top, the highest level, that the leaders, encourage people to get help and seek help, and that it's not a sign of weakness to reach out and ask for some help and admit that you need help, but it actually takes a lot of strength to do that. So I know that culture is changing, and people are more willing to do that now, so that's a great thing.
Right.
Yeah,
Yes.
It's a wonderful thing. It's a wonderful thing. So for people who are having like intrusive thoughts and memories, what kinds of things might they be experiencing?
People who are having intrusive thoughts may be out just, doing whatever, and suddenly have a recollection of something that maybe they didn't recall before, or something that is constantly being replayed. So it could come in the form of a flashback during the day, or also nightmares and things like that. So it can become disruptive to sleep. And so people with PTSD or symptoms of PTSD often have a lot of difficulty falling asleep or staying asleep throughout the night.
And sleep is just so important to mental health and to resilience in general. It's very hard to regain your footing if you're not getting the sleep that you need. So if you're someone who's been experiencing that for a month or two or longer, that's definitely an indication that you need to go and get some help, would you say?
Right,
Yeah.
right. And there's also evidence-based treatment for insomnia. Cognitive behavioral therapy for insomnia is also something that we use to help support any other type of primary treatment for PTSD.
Okay, good. And so that would be something that people, if they're experiencing that problem, that would definitely be something they should seek help from a professional, mental health professional.
Right.
And maybe now who generally does the diagnosis? I know PTSD is kind of a spectrum, so someone can, have a little or a lot or and everything in between. It's not like, like a broken arm, it's definitely broken. I mean, I think that there's a range of symptoms, right, in this?
There's a range of symptoms. However, someone can have a lot of symptoms of PTSD, but if they've only persisted for a month or less, it wouldn't be diagnosed as PTSD, more acute stress disorder or adjustment disorder or something of that nature. PTSD is typically diagnosed by psychologists or psychiatrists, and in some cases, clinical social workers and primary care doctors can actually diagnose or do screening.
And are doctors trained now in PTSD? Is that part of the training that they get? Because I think it's relatively a new phenomenon to even have the name. I mean, we've had war forever, right? But all of a sudden now, I guess since the 80s, we have a label for it.
Right. PTSD has been around in some form or another for a while, but it's only been formally labeled since 1981.